Good afternoon and thanks for joining us. I'm Judy Simpson. Our focus today is on your health. February is both American Heart Month and National Cancer Prevention Month. My guest this afternoon has expertise in both of these important areas. I want to welcome Dr. Susan Lakosky. Dr. Lakosky is Assistant Professor of Medicine and Director of the Cardiovascular Prevention Program for cancer patients at the UVM Cancer Center. Welcome. Thanks so much for being with us again.
Absolutely.
Now, it wasn't that long ago that sort of heart disease was over here, cancer was over here. They're sort of separate. What's the significance about what we're going to be talking about today is sort of the combination of the two?
Sure. Well, I think an important point here is that, number one, women are at risk for cardiovascular disease, especially later in life. But what I think we've missed is another sort of high-risk population, cancer patients. These are patients that in their early stages are at higher risk for actually cardiovascular disease death than cancer death. And we need to increase awareness that this is actually something they can modify and improve their overall health to reduce their risk of cardiovascular disease even after a cancer diagnosis.
And so you brought a slide that sort of illustrates that. Maybe
Sure.
you can sort of tell us what we're looking at.
Absolutely. This was a study that we did and is published this year. It's a national registry of over 63,000 women with early stage breast cancer. And really what it shows is if you look at the total number of deaths in that population, that women over the age of 50 are more likely to die of cardiovascular disease than actually their breast cancer. And this increases as their age increases.
So what impact do cancer and cancer treatments have on cardiorespiratory fitness and heart health?
Yeah, so a couple of things when we look at this data, why do patients with cancer have a risk of cardiovascular disease? And one of it has to do with the fact that they're getting treatments that impact their heart function. But another reason is that they're more likely to gain weight, be more sedentary, and change their behavior, which can impact their cardiovascular risk. And in terms of cardiorespiratory fitness, fitness is a very important prognostic survival sign. And if you're losing your fitness while you're going through your cancer treatment, we've shown that impacts your cancer mortality as well as your cardiovascular mortality. So I'm a really big proponent that fitness should be measured and that exercise training should be an important part of everyone's cancer treatment.
Does an individual's cardiorespiratory fitness and overall health, heart health before cancer impact the outcome after cancer?
Yeah, so this is a great question. We had done a study on this that's was in one of the big cancer meetings, and what we showed is that your fitness level, even 20 years before you develop cancer, is very prognostic of how long you're going to live. So we took 14,000, in this case, men that were healthy, had no cancer diagnosis, and the high fit men survive longer, even if they develop cancer. So we think that your fitness level going into a cancer diagnosis really tells us a lot about how well you're going to go through treatment and if you're going to live longer from a cancer standpoint and a cardiovascular standpoint.
So from your standpoint, being fit should be goal number one right out of the gate.
Yeah, I mean, I think fitness is important throughout the cancer continuum. Pre-diagnosis, at diagnosis, post-diagnosis, and into survivorship. I think this should be a focus throughout life, but in particular, we've shown data that it is a very important thing to measure so that individuals can change their behavior early in life. And it's never too late. Even if you develop a cancer diagnosis or another chronic disease, you can improve your fitness. There's no doubt about it.
And so you were one of the researchers in this breakthrough study in 2013 that pinpointed the link between fitness and cancer in men. Tell us about the study and some of the specifics, because it was very carefully done in a sort of a new way.
Yeah, so there had been prior studies that looked at, does one's fitness predict cancer death? And so fitness prior to fitness in midlife has in prior studies shown that it predicts cancer mortality. But no one had looked to see whether or not if you're fit in mid-age and then you develop cancer, does it end up helping you survive from a cardiovascular perspective and a cancer perspective? So it's really helpful for and very important to know that going into a cancer diagnosis, if you've been fit your entire life, you're more likely to do well through your cancer treatment and beyond. So that was really the unique aspect of this study. The other part is that we had measured fitness, which is done through exercise treadmill testing, in over 14,000 men. That's really not done. Usually exercise is sort of demonstrated through self-report questionnaires. You say,
how often do you?
Yeah, are you fit or not fit?
Sure, I'm fit. I run 5 days a week.
Exactly, but you may be telling me the truth or you may not, but a treadmill doesn't lie. So we had a large amount of data on these men, and so having that objective measure of fitness and showing that it was prognostic of survival among men that had developed cancer was a new finding.
Mm-hmm. And so do you think you could change the risk if you start getting fit?
Well, that's the next study, right? And so now we know the data that fitness is important. The next step is, if you change your fitness and by how much, how does that change your cancer risk and how does that change your cardiovascular risk? We know that if we minimally change your fitness, let's say by going 3 minutes on the treadmill longer, we can reduce your cardiovascular risk by about 15 to 18%.
Incredible.
Yeah, so we need to now show that data in cancer, and that's the next step for my research.
And so that would be then part of recovery from cancer, just to say, not only would it be medical follow-ups, but it would also be physical follow-ups as well, as far as saying, here would be a good plan for you to be on, and you could reduce your risk of being sick again.
Well, I think that there's two parts to this. Number one is, prior to diagnosis,
mm-hmm.
can you get more fit? That's the first question. But after diagnosis, how much more fit do you need to be? And so we're already doing that in Steps to Wellness at UVM within the Vermont Cancer Center. So we take patients that have been through cancer diagnosis, they could go through exercise training for 3 months in that treatment setting. And on average, we've shown that they improve their fitness by 10 to 15%. So we've already shown the data in the survivorship setting. Now I think the next steps in research are really to show it early on, before treatment, before diagnosis, because people need to have objective data to know how much do I need to train. So I think that we're taking the necessary steps, and we already have it for the survivorship setting.
So what's the difference between fitness and physical activity?
Yeah, so it's sort of what we were talking about before. You can tell me, yeah, I exercise all the time. But when you get on a treadmill, so fitness is really the objective assessment of your chronic exercise exposure. So it's not just what I did yesterday or what I did last week. Getting on a treadmill and going at a faster speed, at a higher grade, we're going to see what your actual maximal exercise capacity is. And that's your cardiorespiratory fitness.
Mm-hmm.
And so that's an objective exposure of exercise versus exercise or physical activity is really, what did I do yesterday? And that is not as good a predictor as fitness of survival and both cancer and cardiovascular mortality.
Does it mean that you have to go out and run?
No, absolutely not. So this is an important component of when we're talking about fitness, is that your fitness will improve if you increase your exercise at moderate sort of intensity. So
mm-hmm.
let's say for you, moderate intensity, or for me, it might be going and walking at a reasonable pace. And that might get us to that moderate sort of intensity that we need.
Mm-hmm.
Whereas for a marathon runner, that might be that they actually have to run, because that intensity needs to be higher for them to get the same workout. So a sedentary person to a triathlete, they have different needs in terms of their intensities, but a sedentary person that walks and gets their heart rate up can improve their fitness. It's all relative to that person. And that's why the fitness testing is so important, because I can gauge their training based on where they're starting. Mm-hmm. And that's another reason why I think it's important, especially in the cancer setting, because everyone's had different exposures.
Right.
So some patients just might have had surgery, some have had chemotherapy. So their starting point and how much they need to train is really dependent on what their fitness testing is in the beginning.
Mm-hmm. Now, your fitness testing has been done on men. Are there plans to test women, and do you think that would be different?
Yeah, so In the cancer survivorship setting, we test men and women. The goal for the testing prior to cancer diagnosis, we have plans and the grants about to be submitted to look at both men and women, because obviously this is equally important.
Absolutely. So what can people do who are currently receiving cancer treatment or who have already undergone treatment? Life's Simple 7, I think it's called.
Yeah, so one of the great things about the American Heart Association is they put simple messaging out there to give patients and individuals some way to say, what can I really do that's feasible and can get me going in the right direction to offset my cardiovascular risk. Obviously, we've talked a lot about getting more active. And I think a very important part of that is giving them objective data about how active do I need to be, how fit do I need to be, and that's where I come in. But there are other aspects of cardiovascular health that need to be talked about. I mean, your cholesterol needs to be adjusted, and seeing your primary care doctor and talking about your cholesterol, or just being screened for blood pressure and cholesterol is very important. Just asking the question to your physician, is my blood pressure okay? Is my cholesterol okay?
Know your numbers.
Know your numbers, exactly. And then having some understanding of what kind of nutritional sort of assessment do I need to have. Do I have diabetes or not? It's a very easy screening. And then, very importantly, smoking, which is a very important contributor to cardiovascular risk and cancer.
Right, people need to really take responsibility for their health.
Absolutely. And, we have so many resources in Vermont to take responsibility. We not only have a lot of behavioral programs for exercise at UVM, but we have one of the best in the nation in terms of quitting smoking. A very objective, great resources at UVM to stop smoking.
What else do you want viewers to know about heart disease and cancer?
I think that what I would say is what we talked about just here, is that it's totally modifiable. You can take control. You can take control by coming to see me, and let's get an exercise regimen. You can reduce your cholesterol. You can get your blood pressure under control. This is a very important statistic. So if you are a woman and you have 2 risk factors, let's just say their blood pressure and high cholesterol, and you go through your life with those risk factors, your chance of dying of cardiovascular disease is 58%.
Wow.
If you have those 2 risk factors, but they're controlled back to the level that they should be, your risk of dying of cardiovascular disease over a lifetime is 8%.
No kidding.
No kidding. So sometimes you're born with or have the predisposition for risk factors, but if they're controlled, that's a huge difference. That's absolute risk over a lifetime. 58% versus 8%. A lot of cardiovascular disease, especially for women, is modifiable.
Are people surprised to hear that?
Absolutely. They don't realize that they have so much control over their risk. And we at UVM try to give individuals the tools to help modify that risk.
That's amazing. So before we go, you have some information about Go Red Day.
Yeah, absolutely. So please join the UVM Cancer Center because we have Go Red. It's awareness about the importance of heart health, and it's going to be happening February 6th.
Now, is that something that only patients can take advantage of, or is it anybody?
No, it's anyone that's interested in being a supporter of preventing heart disease in women. Please go to the website, goredforwomen.org. And
so advice for family members, for someone, if you have someone in your family that might be concerned about?
Yeah. So, that's a great question. I'm glad you asked that, because one of the things that I've really appreciated about my interactions with patients is that family members come with their loved ones to appointments. They're invested.
Right.
They're listening so that they can take away the information with the patient and help guide them through that, because they're taking a lot of information. So if the family member can be educated as well, it's more likely that you're going to have someone modify their behavior.
Well, then you're part of a team.
Part of a team.
I want to thank you for joining us today.
Sure, absolutely.
That's our program for today. I'm Judy Simpson. We'll see you again next time on Across the Fence.